When it comes to plastic surgery, most everyone knows someone who has gotten a little nip here or a tuck there. And while most procedures are generally considered safe with a skilled physician, some experts say too much of a so-called good thing can actually be dangerous. And joining me now with more on this is board-certified plastic surgeon Anthony Geroulis. Thank you, Dr. Geroulis, for being here today.
Thank you.
Now, procedures like facelifts and tummy tucks have really become very commonplace, but when it comes to getting multiple procedures at one time, can you do it all at one time, or is it better to spread them out over weeks or maybe even months?
Well, it really depends on the area being operated on. If you're working in the facial area or the head and neck area, you can do multiple procedures quite safely. If you're going to combine the facial area with other body areas, whether it be the chest or the abdominal area or the legs, then I believe it becomes too dangerous.
Do you think that shows that depict plastic surgery, we've got a lot of them on the air now, that maybe they give prospective patients an unrealistic expectation of what they can actually go in and ask for?
I do. I think that they do a lot of Hollywood in a lot of these shows, to be very frank with you, and oftentimes the public gets misled and believes that they can go in, have all of these procedures done at the same time, and walk out and be at dinner a week later, and I think it's very misleading.
Now, you mentioned that there can be possible dangers a moment ago with people getting multiple procedures on multiple parts of the bodies. What are some of those dangers?
Well, first of all, the biggest danger is the length of the surgery time. The amount of time a person is under anesthesia is critical in terms of their heart functions and so forth, and therefore there are certain limits that people have to watch. The surgeon and anesthesia people will watch that closely. The other factors that come into play, if you do multiple procedures in the facial area, for instance, from a sculpting and an artistic perspective, you want to account for the swelling. Therefore, for instance, I sculpt and I would not do a nasal operation at the same time I do the eyes because of the swelling playing against each other.
Thank you so much for your time, and I guess the bottom line here is more is not necessarily better, and it's still surgery. Thank you, Dr. Geroulis, for being here today.
Thank you.